Today marks the World Health Organization's World Patient Safety Day. This year, it focuses on the health and safety of frontline workers in the fight against COVID-19. It comes as the International Council of Nurses has launched its latest COVID-19 report. It includes a survey which shows the continuing increase in the number of deaths and infections amongst nurses around the world. We're now joined by the CEO of the International Nurses Council, Mr. Howard Catton. A very good morning to you. Thank you so much for talking to us. How desperate is the plight of healthcare workers during these times of COVID-19?
Morning to you. As you said, tragically, we now know that more than 1,000 nurses have died around the world. That's in 44 countries, so I'm very sad to say that the true number will be even higher. We think that the number of healthcare workers who are infected could be as much as 3 million. And frankly, we've seen far too many governments who are still being slow or failing to act to prioritise health workers. The clapping has stopped, but health workers are still at the centre of this pandemic. And we've seen other things in our survey as well. There is still a problem with PPE, particularly in some care homes and long-term care facilities. Health workers still being subject to violence and discrimination as well. And less than half of countries are recognising COVID as an occupational disease. And that's really important because the recognition of COVID as an occupational disease means that you'll have data, you'll have standards, you'll have risk assessment and compensation for people who become unwell or tragically die.
So as the World Health Organization marks World Patient Safety Day today, how important is it that healthcare workers are recognized for the work they do?
You're right. Today is World Patient Safety Day, and I am really delighted that WHO have said for this World Patient Safety Day, we're going to put the focus on health worker safety. It gives a global spotlight on this issue, and they're doing that because you can't separate patient safety and workforce safety. It's two sides of the same coin. Where health workers work is where people receive care or treatment. If it's unsafe for health workers, it will be unsafe for patients as well. So WHO are making that very, very clear today, but they're also publishing a charter. ICN have been able to support the development of that charter. It contains a lot of the things that I've mentioned already, and we're saying to governments around the world today to speak up for patient safety, but right here, right now, sign the charter, back the charter.
Let's talk about the latest report released by the ICN showing that more than 1,000 nurses have succumbed to COVID-19. Is there enough being done to bring these numbers down and protect healthcare workers?
We think much more could be done. Health workers still struggling to get testing, lack of supply of PPE, not recognising it as an occupational disease. But another point in this survey, which I think is perhaps a bit of a hidden issue at the moment, but has the potential to have a major impact on our nurses and health systems, it's the mental health and psychological pressures that people are under. If you don't have the PPE, if you're worried about your safety, that adds pressure to you. People are caring for a lot sicker patients, dealing with more patients who are dying as well. The scale of these pressures is really very concerning in our survey, and I think that health systems, governments need to be providing much, much more mental health support as well, because it might not be that these people these nurses leave the health workforce right now, but these are the sorts of issues that could result in people burning out, taking long sickness, worst case scenarios, post-traumatic stress disorder. Last thing we can afford to do is to lose our nurses. We're already 6 million short around the world.
Absolutely. Howard, how are you marking the day? What sort of activities are you going to be embarking on?
We've been talking to a lot of nurses and a lot of our associations today. Part of what we're doing today is to celebrate just the fabulous, fabulous job that nurses are doing, and to say to them, not only are you doing a fabulous job, but your safety is as important as the people that you care for. This afternoon, there's a big celebration with WHO, a virtual event. Lots of different global organisations, national organisations, different health workers coming together to really push this message home and hard. I hope that there's lots of it. There are some significant monuments that have even been lit up in orange colour for Patient Safety Day right the way around the world as well.
Yeah, absolutely important message. Thank you so much for making the time to talk to us. Howard Catton is the CEO of the International Nurses Council. You're watching The Agenda. Let's take a break.